first, I would like to ask your permission to use this video for educational purpose and on internet. So you had 2 spinal surgeries. Can you tell me about them?
They were both laminectomies.
When did you get them?
The first laminectomy was, I believe, in '98.
Okay.
And then the second one was about 10 years back from today's date. I could look them up.
Did it help you?
It helped for a period of time, but not
What
to
period of
an
time?
extent. A year, 2 years.
Okay, for a year or 2 it helped you, but the pain came back.
The pain was always there. It never ever went away. And it just kept getting worse, and it's still getting worse.
Now, I just want to show what that laminectomy surgery is, what you got. Practically, that is removing the back of the bone here, so give spine a little more space. And we know that by doing that, we are actually making a weak spine weaker, and practically, we have a name for that. We call it post-laminectomy syndrome, meaning that we open up the space, but we make a weak spine weaker. And that many of our patients, we know that they end up with that instability in the spine after that. And unfortunately, your situation is not unique. And especially, how much do you weigh?
I'm about 380 pounds.
Okay, so you're a big person and put lots of mechanical stress in that area. Nevertheless, in many cases like yourself, that's the best we can do, because the alternative to that, to stabilizing the spine fusion, is a very big surgery in an open, old-fashioned way. And I understand that over the years, with all this pain that you're having, you have seen some surgeons, right?
I have seen quite a few.
Okay, now let's start first of all, how bad is your pain right now, or generally these days?
I'd say right now it's about a 4.
But when you do things, how bad does it get?
It gets very bad, up to the 10, where
Up to the 10.
I end up having to go lay down in bed.
And that has been for not for just a week or 2, that has been for the last 8 years or so.
About 15, 20.
15, 20, okay.
I've never gotten rid of the pain.
Now, practically, this is what's going on in your back. You have the bone removed in the back, but still some areas of the bone, of the disc, are pushing on the nerves. And obviously, direct pressure on the nerves can be very painful. And on top of that, this is an MRI. Probably if you get a CAT scan, we'll see that bones are really under significant stress.
Okay.
And you have seen surgeons, and some of them haven't really denied that you need help, right? Tell me about your first experience that you told me about, that you saw a surgeon. What did that surgeon tell you? And he's a good surgeon, I know him.
They've all been good surgeons, but it hasn't removed, the laminectomy hasn't removed the pain.
Yeah.
I was told by 2 surgeons out of Florida that it needs to be fused.
Yeah, and I agree with you.
That's where the problem is.
And you saw a surgeon here locally? The surgeon told you you need help, but he cannot help you because of your size.
Correct.
Okay. And he said you should go somewhere where you can get help, and he referred you to the university. Is that correct?
Yes, it is.
Okay, so what happened?
The surgeon didn't want to see me.
Because looked at your weight?
They didn't give a specific reason.
Yeah.
Apparently she couldn't help me.
Yeah, but that's what I'm just very well assuming. He looked at your weight, and he knew, or he or she knew that with that weight, that surgery would be too big of a surgery in the hand of that surgeon. And sort of decided that they canceled the surgery, didn't let you even come and have a conversation. Is that correct?
Correct.
Okay. So, and unfortunately, this is a daily occurrence right here in this town and across every single town in the United States, that when we surgeons consider risk of the surgery is so much higher than the benefit of the surgery, we just don't do it. And we let the patient just go and live with that pain. This is sometimes what we tell our patient, go live with it.
I've had to live around pain pills.
Yeah. Now, all what we did, if we made a big surgery, smaller surgery, and because we use a tube system, we don't have to cause too much damage to the tissue to help patient in your situation. And literally, we have a track record offering this kind of surgery based on some consideration to people who are have higher BMI, we call them, safely.
Okay.
If the pain is gone, what are you looking forward to go back to? What is it what you desire to do and cannot do because of the pain?
My wife lost her eyesight in one side,
Okay.
and I need to pick up the pace for the vacuuming, the
Okay,
dishes,
so
the
just
laundry, and
daily activity.
daily activities to
Okay.
take and help her out.
Yeah, well, I need to ask you for a favor. If once you go back to that, I need you to take a picture of that, you doing that, and send it to me. Can you do that for me?
I'd love to.
Okay, very well. Well, we are going to start the process. That process entails, even though we know other surgeons have told you need help, surgical help, to maximize non-surgical treatment. But once we have done that, once we have gotten more information, once we have put you through our very detailed protocol, I will give you the option of the surgery after I have put you through my protocol, because I have a track record to be able to help people in your situation, okay?
I'm looking forward to it.
Excellent. Thank you so much for the interview.